Namaskar to create awareness on the World No Tobacco Day, celebrated on 31st of May, with this year's theme Protecting Children from Tobacco Industry Interference, which is an initiative of WHO. To create more awareness, we have got Dr. Sunali Khanna with us. She is the head of the Department of Oral Medicine and Radiology at Nair Hospital in BMC. And apart from that, she holds various other positions at various levels. So, ma'am, thank you so much for joining us. My first question, which I am putting in front of you, it's related to the theme, which the theme this year is focused on advocating for an end to the targeting of youth with harmful tobacco products. So, considering India, where we are and what we are doing, please.
A very good morning to all the listeners, and thank you, Gaurav, for this opportunity. I think today is the right occasion to spread awareness among the youth, the adolescents, and I think somewhere we need to increase the spirit of inquiry in all our researchers, in the doctors, in social workers, so that we come to the root cause of this problem and how it's been really affecting our productive population, that is the youngsters. So, as we all know, India is has a large number of people in the productive age, that is from the 20s to the 50s. And whenever we have any disease, like say a oral pre-cancer or oral cancer, the age of incidence of all these disorders or the potentially malignant disorders is always in the younger age. So the population, which is actually supposed to be our asset, becomes our liability. And in our country, because of the variety of the tobacco products and the associated tobacco products that we have, because of the smoked tobacco products, the smokeless tobacco products, there's a huge variety in terms of, the snuff, the gutka, the zardas, the assortment of packaged suparis with tobacco, without tobacco, and a lot of metal ions and added products, which are added as flavoring and, the coloring agents. So that is why they become more addictive. And a lot of planning and strategies have gone into this part of the biomechanics because all this alters the disease process much more than what just tobacco would have done per se. So this becomes even more dangerous than just an average tobacco use. So now in India, we're looking at tobacco use, smoked, smokeless, and the associated product use, which is the associated, like we had a gutka ban in Maharashtra long back. We were one of the first states to start this. And even now, I think India is the only country in which there is no, if we have the Juvenile Tobacco Act in which you cannot, sell tobacco to people under 14 years of age. So I think we are way ahead than the other countries in terms of spreading awareness and, ensuring the benefit of the youth, the children.
So, my question to you, of course, there is a plantation of tobacco going on in India as well. And on the other hand, Government of India is taking special care or putting special focus on the health and well-being of the citizens. I would like to read out to counter these kind of situation, the stakeholders from the industry and the government together have to come with an approach because without the contribution of the stakeholders, it is not possible. So attending so much of conferences on this, how do you see these kind of things? What can be done exactly?
I think India's taken a large leap towards this because we have been working on, with institutes like Tata Memorial Hospital, Tata Institute of Fundamental Research, Baba Atomic Research Center. We've been involved in a lot of core research of, metal ions, cancer causation, oncogenesis, and the toxicity of basic environmental products and how they affect the gene environment interaction to cause this disease. And in all this, one has also learned that there are a lot of social demographic factors and local factors which are endemic to the geographical location that affects various type of cancers. So among this, tobacco is one universal thing which is present wherever it is, and the abuse is obviously established. Now, when we look at the plantations, it's just a matter of information that tobacco plantation is done in so many parts of the country. In fact, it's not about targeting industry or targeting one particular sector. One has to understand that it's a crop, and there is actually no insecticide or pesticide ever required for this crop because no animal, I don't know if you knew, no animal eats tobacco leaves. It's only the humans who are addicted to it.
And
So
I guess it is
basically,
used in some sort of medicines as well.
yes. So it does have some sort of analgesic effect in terms of, alteration of pain sensation and things like that. And other, of course, the Ayush sectors do have a bit of uptake of some associated products, like the alkaloids and all that, the tannic acids and things. But as such, we know that nicotine itself, like only say if you consider a basic cigarette, there are so many toxic products. There would be at least 181 toxic products and carcinogens in one single cigarette. So it's difficult to say if it was this that led to A, or if it was this much of duration and intensity that it led to something more. So in all these things and causation of cancer, there is no dose and effect correlation. So if you have a susceptibility, even a little exposure can lead you into a problem. But the idea is to keep this exposure as minimal as possible. And we already are exposed to so many environmental carcinogens inadvertently. It could be exhaust from, fuel. It could be, environmental carcinogens in terms of paints, vapors and lead and arsenic and so many of those things. So where we can avoid something, I think we have to take special emphasis. That is why industry, the government, stakeholders, NGOs, doctors, social organizations, these sectors have to join hands. And only when it's an interdisciplinary and holistic approach, then I think you can blame or you can target one person. One person cannot be blamed for inactivity. And I think at the end of it, the person, the end user, the youth, the patients, they themselves have to be proactive to adapt.
My question to you, as making aware a woman or making literate a woman is making literate to whole nation, because a woman in the house is considered to be the main member. If we could be able to do these kind of things with especially the women in the house, so don't you think that today with the ratios, I would like to read out one of the liner. On the other hand, recent data from 2022 reveals that 37 million youths aged 13 to 15 use some form of tobacco. In the WHO European region, if we talk about globally, 11.5% of boys and 10.1% of girls in this age group are tobacco users. So the ratio of girls, it is globally, but is also in comparison to boys. So what is the situation in India in these kind of scenarios?
Yes, so I think let's take the first point first. If you say that you educate one man, you give him education, correct? But if you educate one woman, you educate a family.
Yes,
So
yes.
that influence is great. There's no doubt about that. And I think there women have a greater role to play, and I think they should do true justice to that, because in the nurturing years, the early childhood years, the impression of whatever has come down has been passed down the generation stays. So I think there we cannot have a compromise. And women also have a role in managing the pediatrics and the geriatrics of the house. So
Yes.
ultimately, I think they are the main influencing factors. So they have to be educated. One, they have to be motivated to be doing their tasks, which I think is very important, because you need that constant encouragement
Right.
for them to really reach out to the members of the family and then society at large. Now, coming to the problem of where you said women
Girls
in
and boys ratio is
the ratio,
the
yes.
same.
So now, if looking at the ratio now, if you look at the smoked and smokeless tobacco use in India, we're almost equal. I mean, the boys are used to be more, but now the women have caught up a lot,
Yes.
and more amongst the young youth and the adolescents. And
Right.
another thing which is interesting is women have more smokeless tobacco use. So where on one side we're talking at the empowerment angle, I
Yes.
think this angle of where the women have to be very level-headed in their roles and responsibilities, and I think women have a greater role in the in shaping the lives in terms of, because you're shaping another child's life.
Ma'am, question to you is, as government of India has taken lots of initiatives to control the spread of tobacco. It is not from today, it's from the past. So there is, with the journal thing, I would start with: to quit tobacco, call 1-800-112-356. And it is a toll-free number, and one number is given for a missed call, and you can call and other stuff. And I'll like to read out tobacco control laws in India. Ministry of Health and Family Welfare, Government of India, enacted a comprehensive legislation, namely the cigarettes and other tobacco products, prohibition of advertisement and regulation of trade and commerce, production, supply, and distribution, Act 2003. And of course, in the cinemas also, before starting a movie, we see some certain short clips related to the tobacco. So my question to you: are these steps have been enough till now to restrict the spread of tobacco in youths? or there is something more to do?
So I think there are two things. One is that whatever we've been putting into policy planning and strategy, and I think everybody's been doing a great job. But we need to understand that we have to start programs like the National Oral Pre-Cancer Registry programs and the Oral Cancer Registry, which have not been there. So we do have cancer registries, but we don't have the pre-cancer stage registries, which are important because I think the moment it's nipped in the bud and you have a preventive strategy that can affect you initially, that is any day better than trying to solve the problem later, because you need to understand with our given circumstances, the cancer costing and the cancer economics is highly negative in terms of our system. With the amount of cost or the amount of funds that need to go into alleviating the status at the stage of chemotherapy, radiotherapy, and the amount of state and national funded organizations like public health hospitals, which are running, or cancer, tertiary and state run hospitals and tertiary central government organizations which are working, they are draining their funds to possibly tackle things that we could have tackled at, primary, secondary, and tertiary level state health setup. Now, this was saying initiatives. Now, many central institutes, state institutes like BMC, Tata, we keep initiating a lot of policies and fueling national recommendations in the direction. So there was a lot of pictorial warnings. Then how should they be? What should be the size? Now we do have huge pictorial warnings, but are the people really getting affected by it? So somewhere I think that that conscious building has to be there. So it has to be a concerted effort of, as I said, family, the person himself, to be able to absorb what is being given, what is like offered to him, or that sort of warning that comes whenever we go to a movie hall. But how many of us are really affected by it now? So this has to completely change. Now we have some good public awareness videos which are being, translated more for the youth and the youngsters. So that is what's going to start coming now. Then we have some good PAVs of, things like noise pollution, health, environmental carcinogens like tobacco.
I would like to ask you, tobacco products are giving lots of revenues to the government as well. So when you're getting some sort of revenues, you're not serious about the things because it is generating income. So it is just a question to you from your perspective that how this problem can be taken over, especially when it is generating some revenue for the governments.
So I think if you look at it at a very basic level, it's not that tobacco is the only sin. Let's agree to that.
Yes.
Correct? There are so many other sins. So we're not really coming down heavily on everything. It's a part of revenue, yes. In fact, the ITC, it's doing so much good work also. So I don't think that we should be speaking about whether we need to really cut down on it extremely. I think moderation is the whole key, not only in this but in everything else. So we do have, of course, increased taxation. In fact, the GST taxation, etc., tobacco almost equates luxury cars and all the other things. So government has done its bit. It's not that over the past decades, preventive strategies and all these things have not been done. But yes, I think somewhere more adaptable things. And I think it's more important that those strategies and policies need to be absorbed at the grassroots. So I think that's where we need to help, because that's where the partnership of the people is more important.
It is a related question I'm asking you, ma'am. It has been seen that people don't have money to run their houses. They're struggling with it, and especially with the youths, no pocket money and stuff, but still they manage somehow to buy these tobacco products, and they are really expensive. So, how to curb these kind of things? How to curb the mentality? So, are there any awareness solutions to this?
So I think this is where we need to think, because when we started with Maharashtra's gutka ban and everything else that came out of it, we did a lot of research on the packaging and the products associated with tobacco products, the gutka packets and the mixtures, and why would X metal ion act with Y, and which brands had which coloring flavoring agents. All that was done extensively before we set the ban in rolling. And so this ban also led to a lot of it actually increased a little bit the offhanded availability, which actually should not be the case. So, as you said, the youth, they have that intriguing feeling that if you tell them don't do this, they will try it out. So, I think somewhere the family, the teachers, they play a huge role when you're in college, when you're in here, junior school. So, I think the moment you try to control or curb something too much, it has a negative effect. So, that should not be done immensely. But yes, awareness, options to very honorably you stop practice, where you're not, labeled going to a cessation center, or even if you're going, then things have to be kept in confidentiality. So
Right.
all those things will play a large role.
Ma'am, I would like to ask you, as it is out of the box question, what I feel personally. There is NEP 2020 is playing a bigger role, everybody knows, and in
Yes,
various sectors. So my question to you is, can some sort of a curriculum regarding the awareness programs be included in our NEP as a chapter? No doubt some schools are doing these kind of awareness programs, the sensitizations and other stuff. But if it is mandatorily made a part of NEP as as an awareness chapter included in our curriculum, so
absolutely.
it will make a sense. What do you think?
Yes. So I think if you're looking at the school setups, so just for an example, we have institutes through the central government like the science centers. They're doing a great job in spreading awareness. Today itself, we have almost like 300 students online for a awareness campaign by the Nehru Science Center on the occasion of No World Tobacco Day. So things like this, of course, are there. You have exhibitions, you have programs in railway stations. We've organized a lot of street plays today. Yes, I think school curriculum absolutely important. I think not even when NEP is a little higher, of course, that is going to mandate its uptake at even NCRT books. I think they need some sort of at least a sensitization towards what is right, what is wrong.
As we talked about, that it should be a collaborative effort from the government and the stakeholders is a broader statement, from the plantation to the industry, selling all kind of tobacco products. To reach this objective, I'm reading a line for you. To reach this objective, the industry strives to establish an atmosphere encouraging people to embrace its products. So, how do you justify this? I'm talking from India's perspective, as we have spoken a lot, what can be done, what cannot be done, and what are the implications.
I think stakeholders, as you just said, it's not only the government, it's not only the people. There is a huge plethora of people in the middle. So we have everybody who comes together. So targeting any one person is not right, and saying that we need awareness sector only for these people is also not right. So I think, and all this, the whole concept of temptation and advertising. I don't think you can penalize industry or a certain thing like an environmental carcinogen or something to eat. If you look at it, we've had so many campaigns about food additives, preservatives, this, that. Someday it is like this carcinogen is coming from this food product, water has arsenic. Objectively looking at it, we need to see that as a public health industry, serious action has to be taken from public health foundations, private, public, all of these, to first get the awareness and action, get the mode set that the information is meted out correctly to the people about the products, and they have to be correctly depicted. So the exact contents, which even food doesn't do for us today. After all the approvals, we seriously actually don't know exactly what is what in many things. So I think their clarity is important so that the person himself can choose, making him aware and making sure that some preventive strategies are in place, which for us they are in place. Taxation is higher, all the other things are there. Pictorial warnings are being given. The size of the pictorial warnings and the intensity are being altered. So I think from our front, the doctors, the public health scientists, I think enough is being done. But yes, what is required is not to stay contained in your silos. So we need collaboration from all these disciplines.
Ma'am, last liner to you. Is this on the priority list of the One Nation health policy?
Yes. So here we need to make it very clear that it has to be a one nation, one decision and policy where it's regulated very strictly.
Thank you so much. This was Dr. Sonali Khanna with us.